Okay, hi everybody. Thank you for joining me on another episode of Get Into It with Gila. I'm Gila Glassberg, registered dietitian and certified intuitive eating counselor. And today I have Michal Simon. Hi, Michal.
Hi, thank you for having me.
Thanks for coming on. I'm so excited.
Me too.
Okay, so could you just tell us a little bit about yourself? Where do you live? Where do you work? And what do you do?
Okay, I'm an LCSW, licensed clinical social worker. I work in Cedarhurst, Long Island, in the Five Towns, and I work with children, teens, and adults. I specialize in trauma, anxiety, depression, relationship issues.
Got it. Very cool. So what are you most passionate about?
I would say working with clients is my passion, and trauma is definitely a passion of mine. I like working with complex trauma a lot. Complex trauma is when someone has had years of traumas. They could be little traumas. It's called little T traumas, usually from a caregiver or in their childhood environment, and then they're working on it as an adult or a teenager. I love working with parents. I work with children all the time. I have a play therapy station over there with sand tray therapy and art therapy. So I find that my day is going between children and adults, and I love that change back and forth between sessions because it's so different, but you're still working with the human needs and what everyone is going through. So I love that.
So you kind of like see all different
like
ages.
Throughout a day, let's say I'd have 8 clients a day. I'd be going from like a 4-year-old to a 16-year-old to a 25-year-old,
Mm-hmm. Wow.
And then all day. And I really like it. And it's very different, but it feels the same in terms of the trauma work. And it's just a different modality.
Right. That's so interesting. So could I ask you, how did you pick this as a specialty, if you don't mind me?
Sure. I, like most therapists, had been through things in my life. And I found that the thing I found to be most inspiring about people is when they recognize that life is full of challenges and they use that for an opportunity for growth. And I really just love working with that depth. And it's inspiring to see people work hard on their life and work on self-growth and put that as a priority. So I just really connected to it.
That's beautiful. Did you always want to be a therapist?
Yes, I did a few internships in college and high school, like nursing and therapy, even alternative therapy, like massage therapy. I did an internship at Memorial Sloan Kettering in their alternative cancer center. So they do therapies there, and I shadowed people. And I'm not so into working with the body in terms of blood and the nurses have to do. So I really knew I wanted to be in the caretaking field. And then I always had a love for psychology. So I knew it was the right thing.
I could relate to that because yeah, I can't if I get a cut, I can't even see my I'm really squeamish. So yeah. But yeah, helping people is definitely a passion of mine as well.
Yeah.
So when we were discussing the podcast, we were talking about different topics to cover, and I thought it would be really interesting to talk about enabling anxiety and too much control, right? So I thought that would be a really interesting topic in terms of intuitive eating and division of responsibility, because I see that in my practice with adults, let's say that they're feeding and they're eating was too much manipulated as children, so now they're struggling as adults. Then I also see it with children that they're going through it right now, that their parents aren't able to feed them well because they're either controlling them to stop eating or controlling them to eat. So could you speak a little bit about that?
Yes. So I see this in my practice all the time also. I either see it on the child end, where a parent is coming, bringing a child in, even just to work on picky eating, or I actually have a few adults who had some little traumas from forced feeding when they were younger, and it kind of turned into an eating disorder. That's not always the case, of course, but it's just, I think what food is another representation for children of their trying to exert some autonomy. And, in terms of Eric Erickson's, hierarchy of development, children between the ages of 18 months and I think the age of 5, they have autonomy versus like shame and doubt. And when they can't get their autonomy, then they go to shame or they doubt their ability to make decisions for themselves. So it really impacts the psychology behind it. It's not just about the food.
That's really interesting. So could you talk a little bit about a parent, let's say a child coming to you with anxiety because they struggle with anxiety, and sometimes you'll see like the parent perpetuating that.
Right.
How does that work?
So there's this concept that overprotecting and micromanaging enables anxiety. And it's a hard thing for parents to wrap their head around, and I completely understand because you care about your child a lot, and you want to make sure that nothing bad happens to them, and you want to protect them. But when we do that, we are taking away the child's ability to problem solve, and we're trying to protect them. And then that gives the child's anxiety or just the child's mind the message that they can't handle difficult situations or challenges or develop a level of frustration tolerance that will happen in life because life is full of frustrations. And part of growing up is we have to learn how to deal with those and then be calmly problem solve. But if a parent is taking away those opportunities for decisions or just taking away those opportunities to be in an uncomfortable situation, and then the child is just being the mother or the parents is swooping in, or even a teacher is swooping in and saving the day, then the child doesn't have the opportunity for growth there. And it's almost better to let your child make these small mistakes now and be comfortable with that and not have any shame involved in that. And it's an opportunity for growth. So when a parent overdoes it from love and a little bit of their own anxiety, which we'll talk about, I'm sure, then it's really actually increasing the child's anxiety about their ability to deal with problems that come up in their life.
That's really interesting, and it just makes like perfect sense. But as a parent, I'm thinking, how do we know when we're overprotecting? I mean, obviously, maybe like a therapist would say that, but lots of people don't go to therapy. Lots of people don't bring their kids to therapy. So how do we know when we're doing that?
Yeah. So you could ask yourself, am I noticing stress or anger in myself, stress, anger, or anxiety in myself, where I feel like I need to fix? And so there's a couple things. The first thing is, am I noticing any reaction in myself? So am I stressed at all? Am I anxious at all about my child's issue that they're having right now? The second thing I would think is there's this, in CBT, cognitive behavioral therapy, there's this cognitive distortion, which is sort of like a mind trick that your mind plays on you to make you think unrealistically. So it's called catastrophizing, or for children, I call it disaster forecaster, where you're imagining the worst case scenario. And since we're not always aware of our thoughts, we don't always know that we're thinking this way, but most likely you're imagining that the worst thing will happen with this child and his problem that he's having right now. And then you're trying to protect him from that, instead of being present in the moment and figuring out, like, if he's having this issue, maybe I could take a step back, be aware of my anxiety and let him sort of work it out, and then give him the opportunity to problem solve. So you just sort of weigh how important is this issue and is it within his capability to actually try to figure this out on his own.
So could we give an example of something that would be something that a child can figure out on his own and something that a child couldn't?
Yeah. Let me think. I want to give an example of something that happened this morning with my 4-year-old. So I was getting ready, and he and the older kids were out of the house. And he came into my room and he's like, oh, I found this toy and I'm going to bring it to school to show my friends. And I'm like, that's really sweet, because opportunity for socialization, and he's trying to show his friends something. And he's like, I took it from, and he mentioned his brother's room. And instead of being like, you can't take things from someone else's room, put it back, right? Because that would be where I'm swooping in. I'm anxious that he's misbehaving, which really, just to show you how the disaster forecaster or catastrophizing can jump a few steps ahead without my realizing. What I'm really afraid of behind this is my child is misbehaving, which means there might be something wrong with him, which means he might not be able to function in society when he's older. And it's my job to teach him what the right thing is to do, right? Discipline. Your child should be taught by your parent, right? But then I took a step back, which I'm not always able to do, and it's really a work in progress for everyone. And I said, you took that from your brother's room. Do you think he would want you to do that? Do you think that if he found out that you took something from his room, how would he feel? You know, and I just like laid it out for him with questions, like open-ended questions for him to think about it. And he stayed quiet for a little. And then I came downstairs and he's like, I'm not going to take the toy because I think Menachem would be upset. And then he put it on the front hall console table. And I was like, wow, you're right. I think he would be. And that was very big of you. So like, I could have been like, no. I can imagine my other son being very upset about it. You know, I can imagine all these disaster forecaster or catastrophizing scenarios. He might lose it. You know, he's 4, he might lose it at school. Instead of doing that, I just sort of posed the question to him so he could problem solve. And he did it.
Wow. That's like, I'm like already reacting to that because I'm thinking like, I wouldn't like, I really have to think about this because like, if this was me and this would happen, I would be like, I wouldn't even notice that thought process. I would just be like, what are you doing? You know, like put it, obviously.
It could be because I was in the headspace of getting ready for this, but yeah, it just came to mind. And of course, you know, you don't have to get this right every time. And you could sort of look for different opportunities where you could catch yourself. But those opportunities are really growth opportunities for your child when you could catch yourself.
Right. Because I'm thinking like my 2-year-old takes a lot of my 5-year-old's stuff. And then my 5-year-old gets really upset. My 2-year-old can't understand that, obviously.
Right. He's too young for that, probably. Like that problem solve.
Right. He's too young
probably
for that.
Would need that boundary of he probably has to just put it back himself, or it has to be taken from him and redirect.
Right. So that's really it's hard as parents, like to know like what our kids can handle and what they can't. Like and even like a 4-year-old, like it would really probably maybe your 4-year-old a little more mature.
Right. Or he's 4 3/4 or whatever.
Right.
You know?
Right. Or you just know like like as a therapist, you might know like, okay, he's capable of this or he's not. Like, would you say like a 3-year-old would be capable of that thought process?
I'm not sure. I don't think so. I don't think a 3-year-old can unless you've seen that the child can, you know, reason that way. And the other thing is you could try it, and if it doesn't work, then you just see that the child needs you to take it in redirection.
Right. I was just thinking that like in terms of people who are going to be listening to this and what you just said, like autonomy versus shame and doubt. I was like, that's what we all like, even as adults, you know, like we're all like, let's say with dieting, right? With like food restriction. So like, I say this like a million times a day to my clients on my podcast, whatever, like dieting threatens like the most basic autonomy that we have, how we feed our bodies. Without food, we will die. Right. So like, imagine if somebody was like, I mean, this probably does happen like in school, but if somebody was like, no, you can't go to the bathroom, like you just went, or like, you can't, exactly. So like that, the dieting says like, don't trust yourself. You don't know what your body needs. Right. So then we do have all this like doubt and shame about our bodies because dieting is telling us like, if I just cared enough, if I just tried hard enough, I could just not eat the pizza, or I could just not eat the cake. And then what happens is obviously you do eat the cake or you do eat the pizza because like dieting doesn't work. And then there's all this like horrible baggage.
And speaking of the horrible baggage, you're reminding me that the definition of trauma is when you go through something difficult and you were helpless to stop it. If you went through something difficult and you helped yourself and you were powerful as opposed to powerless, you actually aren't as traumatized because you're not stuck in that. But when a child, let's say, is being forced to do something and it's scary, the way the mother is or the father is, you know, acting because they're acting anxious and therefore a little scary to the child. And then also they couldn't stop it. That's, I guess, how it could be formed.
Really interesting. So before you were saying about like, if we notice our own anxiety, right? That we might be, is that like a transference thing? Like we automatically transfer that?
Yes. So there is this clinical psychologist in Manhattan named Dr. Shefali Tabari, and she created this, I guess, school of thought that is called conscious parenting. She has 2 books, I believe at least 2, called The Conscious Parent, and then there's The Awakened Family. And the idea is that if you can be a conscious parent, it means that you can be aware of the triggers in yourself as a parent, and you start to note and be aware of why your child's, I guess, independence seeking or defiance is triggering you, and then why you're trying to then control it. So it's about being mindful and present with your own feelings and thoughts as a parent. And I think one of the most valuable things a parent can do, of course, not everyone can go to therapy, but I love working with children. And I think that some children, of course, children need therapy as well, but in certain cases, but if a parent can go to therapy to work on their parenting and the triggers that their children cause in them or bring up in them, then that's the most valuable thing you're doing, because you are then creating this stability in yourself that you can create a home of stability for your children and for yourself and your whole family. So what Shefali Tabari says is that when it's not a matter of the children's defiance, it's a matter of what is it triggering in the parent that they need to be vigilant now.
Mm-hmm.
So I have an example that I often think of from her book. I read it years ago, but this always sticks with me. Is like if you, it's in the morning and your child is getting themselves dressed and they pick something quirky to wear, like an outfit that's a tad off, or you just don't agree with it, or whatever. It's not your style.
What age is this child, by the way? Let's just.
I don't remember because I read it a while back, but let's say 8, or even older, and or younger. And really, at any age, I would say this example, comes forth. Is so the child puts on something a little quirky, right? Instead of feeling, instead of reacting with, no, you have to change that. You could try to be aware of what it's bringing up in you. So it might be bringing up an insecurity in you, that the child will look weird, and then people will make fun of him, or people will think he's strange, and then he'll have a problem socializing, and then he won't be liked by anyone in the class. And you see how I'm going to the next fear.
Or people will judge you as the parent. That's a big one.
Exactly, that's a good one. Or they'll judge me as a parent that either I'm not attentive and I don't get him dressed well, or that I'm weird because he's being weird, or whatever it is.
Right.
Parents usually aren't aware of how it triggers them. And so if you then control the child in that moment and you make him change, then you're really reacting from your own worry or your own anxiety or your own insecurity from your childhood of not fitting in some way.
Right.
Instead of letting the child express themselves, and hopefully, they'll notice that no one else is wearing something like that, or they're a little quirky, and that's just who they are.
Right. Right.
Now, I know that's hard.
That's a really good example.
Yeah, because it probably comes up for people, and it's probably also hard. Let's say, I would say in some small communities, like the kinds that we live in, people feel extra pressure. I feel like in communities where people are similar to each other, like religious communities, there's extra pressure than in a random community that doesn't have that same type of lifestyle for everyone. So there's pressure. And you could do the same thing I did with, the 4-year-old and taking the toy. You could pose it and be like, maybe later, you could be like, oh, do other people wear that? Just posing the social question of relatability. Right. Letting the child think about if he's being relatable. But otherwise, like, let the child express themselves. You can ask yourself, what are going to be the consequences of my child? What's really going to be the consequence of my child wearing that funny thing?
It happens to be an excellent example, because this is what I'm thinking, but whatever. I want to hear your thoughts. Like, is there like, a boundary with that, or like a limit? Like, what if your child's wearing like a yellow shirt with like flip-flops in the winter, you know what I mean? Like what I mean?
That's a fun one that you're bringing that up. I'm so glad you're bringing that up, because there's another book called Love and Logic. I could actually look at the author's name. It's right behind me over there if you want. But
no, I'm gonna get the names of the books and then I'll put them in the show notes.
Sure. So Love and Logic, there's a concept in there that I remember, also clothing related, which is what if it's the middle of the winter and your child refuses to put on a coat? Right. So according to this book, it was saying that you want to teach your child to learn from this lesson instead of forcing your child to wear the coat. So you let the child go one day and not be afraid of that, old wives' tale that a child will actually get sick from going out in the cold. Of course, there is some validity to that, but just in terms of the immune system. But basically, you just let the child, suffer for that one day and hope that they learn a lesson from it.
It's so interesting that you're saying this, by the way, even though like this is so not what we were meant to talk about, but it obviously was, because it definitely parallels with like the food, like 100%, which I want to say in a second. But I really do want to think about this, because I am that type of mother that's like, I mean, with my first, I was much more insecure about it, but like, let's say my son's too, like, when you go out and like, everybody's like, he's not wearing any socks, and like, you're like, I know, like, he took them off. Like, if he was cold, he would cry, because like, that's how babies express themselves. Like, she's freezing. I'm like, she's not freezing because she'd be crying, like.
Right. The child would express if they're uncomfortable. That's a good point.
Exactly. Yes. And that's, so how I would want to, let's say I would want to parallel that with something with food. So I actually just talked about this on a podcast that I put out yesterday. I was talking about Hanukkah and latkes and donuts. That's what I was talking about. So I was saying that my 7-year-old, my almost 8-year-old daughter, she went to like a Hanukkah party maybe last year or 2 years ago, and she came home and she's like, my stomach really hurts. I'm like, well, what did you eat? And she's like, I had 2 donuts and 2 latkes. And like, I promised old Gila, like 5 years ago, Gila, before intuitive eating and health at every size, I would have been like panicking, like, oh my God, she ate so much and blah, 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 all that noise. And I was just like, oh yeah, like a lot of, like, sometimes when we eat a lot of oil, like it could sit in your stomach and it could really hurt your stomach. And now, like, when she's at a place where there's like oily food, she's like, Mommy, how much food do you think I should eat that would hurt my stomach? Or like, and I'll ask her like, well, how much did you eat last time? Or what do you think about this? Whatever. And like, it's amazing to see, like, when they have that autonomy, you see them trying to make good choices, like, but not from like, not good choices meaning like diet choices. I mean good choices, like what feels good in their own body. But what I would really like for you to explain, or like, until I learned about this, I never would have believed that it was true. I would have thought like kids can't make their own decision, or even adults, like we need to have more boundaries, let's say. But really, like,
I am a big believer in structure and consistency and following through on consequences. So it's not a free for all in any way, shape, or form. It's more that when the situation would cause, but when I realize that I'm exaggerating the negative consequence that can come out of giving my child this independence, when I realize I'm exaggerating that, I will take a step back and let them decide. But if I have to intervene, which is most of the time, I would say, I do.
Right. So meaning you just said most of the time we do have to intervene.
Right.
So
yeah.
Like, let's say with food, right? So the model that I use with kids is division of responsibility, where the parent decides the what, the where, and the when, and the child decides how much and if any. And then there are boundaries within those boundaries, which are that the child has to be offered food every 2 to 3 hours. Some people even say every 1 to 2 hours, depending on the age, and that there always has to be a safe food around, a food that your child will like, right? So there's a lot of boundaries in there.
Yeah, which is good.
But then outside of that, you're sort of like, you're really letting the child make the choices.
And be in touch with what their body is saying to them.
Right. So like, let's say with other things, let's say not with food, where would we, like, what is, I guess, like, this is really general, but where would we have to intervene and where would we not have to intervene? Like, how do we know that?
So of course, with safety, you have to intervene. Also, like, I don't know why this is coming to mind, but like if one child, between children fighting, yes, it's okay to let them work it out, but once it gets physical, which is very common with siblings, you have to protect the one that is getting hurt, obviously. And right, it's general. So I'm trying to think like different areas, like homework.
Right.
It's really up to the parent, but I would say that if you notice that you're over managing, or you have to do a lot of legwork to do something, it's better to have the child learn the consequence in the moment. So let's say with homework, if your child is putting up any fight about it, not any fight, but whatever, if it's becoming a battle of wills, I would say it's better to, depending on the age of the child, like, you could say something to the teacher and just say, like, he doesn't really want to do his homework. Is there any way for there to be a natural consequence in school? Because it's not really a matter of the home, it's a matter of school. You just sort of like let it play out. And another fear that parents have often is my child will fail academically.
Right.
I always use this when I'm teaching catastrophizing and disaster forecaster, which is like, I do a lot with, like, let's say teens or preteens who are anxious about school. So I'll be like, so you're nervous about this test. And then you're imagining what? So they're like, I'll fail the test. And then what? I'll fail the whole year. Then what? I won't graduate high school. Like, they realize how silly it sounds once we're doing, and then what? And then what? Or what if? Right. So as a parent, if you're noticing that you're trying to overprotect to avoid the then what at the end of this, which is my child will fail out of school, try to just take a step back. And when you see that, this is the thing. If we see a child going against us in terms of like fighting or, just refusing, then that is a sign to tune in to what am I fighting against my child that is really maybe coming from a trigger of mine. That's really the telltale sign of, are we having a battle of wills? Is there a control battle going on? If that's the case, am I not present and grounded and listening to what my child needs right now, versus am I letting my anxiety take over? Not versus, but I'm saying, am I letting my anxiety?
Can you repeat it so that I can know, and like when we need to check in?
Sure. Yeah, you want to check in when you notice that you're getting into a fight, like a battle of wills with your child, and there's a control battle starting where you're saying one thing and they're saying the other thing. And it's usually a sign that you're pushing or trying to control too much, and you're pushing against a child who's trying to establish his autonomy about something. And if you keep fighting, what's going to happen? It's going to blow up and you're not going to get anywhere. That's usually how it ends up. And no one thinks about that, but that is how it ends up.
Right.
So if you could take a step back and think about, I'm trying to control something right now, probably because I'm anxious. What am I anxious about? Most likely, you're anxious about the worst case scenario. Your child not coming to school with homework one day, or even for a week, or even for a few weeks. Are you able to control that really? Not really. You have to let the child come to school with no homework. You could check in with the teacher and see, I'm noticing my child is refusing to do homework. What can we do about this? Can you do a consequence in school or a chart in school? Not a bad consequence, just something. Right. Or encourage him in school.
Right.
But if you're butting heads with your child, usually you're getting triggered. And you're not hearing, that's where the consciousness comes into, or like the mindfulness with eating also, is you're not hearing, with parenting though, you're not hearing what your child really needs right now.
So I have an example that is coming to mind, which I'm not sure, because I had some mindfulness, but some triggers probably, let's say. Like let's say yesterday my son came home and he's like, I want to have a play date. And it happens to be I had some other kids over because whatever, I was watching my friend's kids, and one of the kids is my son's age, a girl. He wanted to have his friend from school over. So I said, okay, sure, I'll also invite your friend over. Like, I just really wanted him to be occupied and happy for my own benefit also. So then by the time the other mom said yes, he said he already switched. He wanted a different friend. So then, but the mom brought over the friend, which was so nice of her. And she was like, and then my son's like, no, I don't want to play with him, And I'm just like, I was so frustrated. I was like, I'm trying so hard to give him what he wants or what he needs. And I definitely noticed and I was trying so hard to get in touch with myself and think about all those, how to talk so your kids will listen and whatever. And I was like, okay, he could be upset. He's allowed to be upset. But then I was like, I was frustrated because I was maybe I was trying to fix the situation too much.
Right.
What do you
Were
think?
you also reacting out of worry that he'll just reject that friend in front of him? What ended up happening? That's my question also.
Yeah, probably. I was also thinking like his friend just came over and now he's being so mean, you know? What ended up happening is that he went into the other room by himself and he's like, no one's playing with me. And I'm like, I'll play with you. Like, I just felt so bad. I'll do the puzzle with you. And then I was like, you know what? He could, like, I did everything I could do. He could be upset. That's what I thought.
Right.
And then eventually he was upset. Like, he was moping in the other room. And then eventually he came around and I was like, wow, I just went into panic mode. I just became I just accessed my inner child. I just like, I was aware of that on some level, you know?
That's great. Yeah. Right.
So,
Because really, Dr. Tabari, she really does point out that the anxiety or the trigger that we are having is coming from our inner child insecurities that we didn't work through or that we suffered with.
right.
So let's say the person who's trying to control what their child is wearing probably felt like they didn't completely fit in growing up, you know, and so like that's being triggered from their own inner child experience.
Right. That example is actually really, I'll tell you why I find that interesting. Cause like probably one of two things could happen, which you already said, but let's say a child is very socially aware and they wear something socially off and they go to school and they pick it up and they change the next day. They realize, right?
Right.
So that's one option. And let's say they pick it up, but they're fine with it. They're fine with being different. And
Yeah.
and the parent could either, you know, shame them inadvertently, or they could be like, I love your style, you're so unique. A lot of kids become really socially like very well accepted when they accept themselves. Like they don't
Right.
always become like the social outcast just because they're different. Sometimes when
Right.
I feel like like the people who I know who are like that and they're confident about that are always like the most popular people.
Yeah. And yeah, it's a very good point because it's a very like physical example, but really what matters is the child's self-esteem underneath all of it. So if you don't shame and you just encourage a child to pick their own things in general and let them be their own unique self, then you're tuning into what your child is expressing and wants, and you're just instilling self-confidence, which is wonderful. And at the end of the day, yes, there is a concept of fitting in socially, and that's important. Fitting in physically, and that's important. But more important is that your child has a self-confidence and then chooses healthy friends or chooses people who value them for who they are. So the confidence you instill in your child will help them seek healthy relationships when they're older, or even as a child with their peers. So that is, you know, of most importance.
Right, because sometimes a child will dress like weird or do something odd because they're not getting a need met. Like they're not getting attention. You know what I mean?
Right. 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 Also looking for negative attention.
Right.
That's true.
Right. So I'm just saying like that could even be like a rebellious thing, like not
Yeah.
even consciously, but like the same thing with food. Like a child who's, let's say, forced to eat might like Dafka, like just stop eating. Or a child who's like forced to stop eating candy, you will almost definitely rebel. And
Yes, that is because that is a combination of two things. Like you're saying, it's the seeking negative attention because if a child's not getting enough positive attention, or they're getting more attention for the negative behaviors than they are for the positive, then a child wants attention from the parents. They want interaction and engagement. So let's say I'm going to give an example, which I'm sure a lot of people can relate to, and I'm not saying in the judgmental way, but let's say you're on your phone and you're texting, and then all of a sudden, or whatever, and you're around your children, and then all of a sudden your child does something they shouldn't have done, or like you're not happy with. All of a sudden you look up from your phone, and that's when you give the attention.
Right.
So your child is like, if I misbehave, that's how my mother pays attention to me. So that just happens. They're looking for negative attention.
Right.
But at the same time, it's either that or it's them trying to be autonomous and independent, and then they're testing the boundaries and seeing if they're allowed to have a voice. So like it could be either one, really.
Isn't that like the nurtured heart approach, where like you don't react, like you almost don't react at all when there's negative behavior, because like
it's called active ignoring.
Right, that's hard.
It is. It really is. And you ask yourself, like, is it worth responding to this? Is anyone really in danger? What's the consequence really going to be if I don't pay attention to this? It'll probably be fine. Then yeah, I'm not going to give it negative attention.
Right. I mean, I didn't actually read the book, but my sister-in-law, she was explaining it to me, and she was just like, think about when your child like does something wrong, and you just like are so animated, like even like, I mean, I've heard this. I haven't heard it in my office, but I heard it.
What is the book?
The Nurtured Heart Approach.
I don't think I've read it. I mean, I don't think I've heard of it.
Okay, so that's like where you just ignore as much as you can negative behavior, and you praise like a ton for positive behavior.
Yeah.
So what I was gonna say is that I've heard that like kids who aren't like touched enough, let's say like they don't have enough positive physical touch, like they'll even like look to be hit because they need contact, they need physical contact, which is like so heartbreaking and so sad.
Wow. Yeah.
But it's the same thing with like the negative attention. Like if a child's getting zero attention for the positive, then they're just likely to look for negative attention.
Yeah. And also, it's important to note that when I say positive attention and praise, there's a concept from parent-child interaction therapy, which is that it's not just praise, it's labeled praise. So you want to label the thing you're seeing and not just praise the child with these sort of open-ended compliments like, you're amazing, you're so smart.
Mm-hmm.
It's more like, I love how you put the red block over the blue block.
Mm-hmm.
I really like that.
Mm-hmm.
So like you're giving positive attention for something they did with their own abilities and strength. So you just label it. You give specific information with your praise.
The thing that like, right. The thing that like that's really like has hit me hard with all the parenting stuff that I've learned is that all this stuff makes like perfect sense in theory, but like in action, it's almost like impossible.
It really is hard. It really is.
Right.
It takes years to work on picking up on what's being triggered in you.
Right.
And then calming that and then responding appropriately.
Right. By that time, your kids are married and.
Yeah, it depends how early you work on it. I always find that like whatever the first child was going through is not the same thing that the fourth child is going through.
Right.
And you just keep on working at it.
Right.
And it's really a lot of it is about consciousness and mindfulness of being present and being aware of what's going on as opposed to being stuck in your cycle of thoughts.
Mm-hmm. The thing that hit me the most is that like the inner child work, like a lot of times, like what you're saying, a lot of times, like when we're triggered by our kids, or like, let's say the example with my son, like I was just trying I wanted praise as a mother. Like I wanted positive reinforcement from my son. Like, good job, mommy. Like you got me a play date, but like, that's not what we get as mothers. So we have to give it to ourselves and be like, Gila, you did everything, like literally to myself, you did everything you could. Your child is safe. You met his emotional needs, and he's allowed to be upset. Which is, by the way, like one of the most powerful tools I could give my clients, because the food is what they feel this, right? Like, let's say the example of yesterday, I would feel so triggered by my son, and then I didn't know why, or I haven't worked on this thing, so I couldn't identify it. So I'd just be like, where's the cookies? And so I'll say to my clients, like, can you sit with the discomfort that your son, even though you work so hard, your son is still upset? Can you sit with being upset, and even for 5 minutes?
And also to take the shame away for yourself and your inner child of like, you did what you could and you did a good job. This is out of your control. It's not a reflection of you.
Right. So I think that like the main point is that like, it's not really about the outcome at all.
Right. Yes. It's not about winning.
Right. That's the hard part.
It's about attunement to yourself and then your child, and separating those many times.
Right. It's really interesting. Yeah. Okay. So is there anything you want to leave the listeners with, like specifically?
Let me just see. I wrote a few things down that I wanted to say. Well, one thing I did want to say also is that, like, if you give your child that opportunity to like make the decision themselves, you're also just giving them the message that they can handle it. And often I find, like, let's say a child has separation anxiety, then the parent also often looks nervous,
Yeah,
you know, because they're
definitely.
worried about their child also. Like,
Right.
if you can, you know, have that confidence and that calm, I always say you want to be the calm you wish to see in your child, you know, and it's
Mm,
very hard. And one thing I found to be very helpful in parenting, as well as just anxiety for adults and children, is that when we're anxious, our mind and our body is racing and we go into fight or flight mode. Our blood is pumping, the blood flows to your extremities. You can either punch,
mhm,
fight, kick, run
mm,
away,
right.
and you're not thinking straight. So if you can slow things down, I almost imagine it's like everything's on fast forward when you're anxious, but if you can slow mo and just slow it down and imagine that everything that you're seeing and doing is actually slowing down, then you can tune into the little hints here and there that you're getting from the environment or your child's face, right? How often do we not look at our children's face and also go down to their level and see what's going on for them, because we're so wrapped up in the chaos of our mind, as well as what's going on in the home with little children or just many people, or your work stress that you've taken. So just slowing down so you can tune in and calm down and realize you're not in a dangerous situation, even though your body's acting that way. And just look at what the situation is and look for opportunities for growth and letting go. Um, yeah, and treat
So,
yourself well.
yeah. Yeah, I feel like that's been like something that I suggest a lot. Like, can you journal for 5 minutes? Can you meditate? Can you put on relaxing? Like, I really like binaural beats. That's like
Mhm.
relaxing music. Like I got it on YouTube. Like it just, I don't know, it really does slow my brain. Or even like I happen to love like going for a bike ride, like going exercise, like getting the
Yeah,
adrenaline out, and then like looking
yeah,
at the water, like anything. It is really hard when you're in the physical anxiety, like, and your body is literally telling you something's dangerous. Like
yeah.
I feel like you need to have like a cue, like
Yes.
figure out what your cue is that would slow your body down.
Usually noticing where you could ask yourself, or I do this in therapy, where you figure out, like, what is that physical cue of my knowing that now I'm in anxious mode, because you can't
Hmm.
always know it cognitively, but you can
Right.
figure out, if you get in touch with your body feelings, you know, oh, I'm in anxious mode, or like, I know I'm about to yell at someone because now I'm angry, and when I'm angry I get a buzzing headache, or when
Uh-huh.
I'm nervous, like, I feel uptight and I get tingly feelings on my skin. Different things like that people are not even aware of happening to them. If you can tune into the body, then you usually could then hint to your mind that my anxiety is overactive right now and I need to slow down. And breathing is huge, because with the fight or flight reaction, since your oxygen is compromised because it's going to your extremities, you're not in equilibrium. Not
Right.
in equilibrium. So if you can breathe, you're restoring equilibrium so your mind can think clearly.
Right. I tell that to my clients also, like they get, because, well, there's a lot of reasons, but because like dieting sort of turns off your hunger fullness cues, because it tells you what to
Mhm.
eat, when to eat, how much to eat.
Right.
So we have to like almost like reinstate that. But then there's like all this confusion between like, is this physical hunger? Is this emotional hunger? And one of the ways that like somebody's able to figure this out is to literally identify, like, what does hunger feel like in my body? What does
Mhm.
anger feel like in my body? What does frustration? Are you confusing them?
Right.
And
And it's
so,
something bothering me now.
right, so you really you do have to know what the signals are, because otherwise you can't really respond accordingly if you
Right.
don't know what the so who's ever listening to this, obviously no shame and no guilt, and no, you're not going to listen to this and then know the answer. Like it's going to be
Yeah.
a practice, and you're going to, the more that you're able to like listen to the cues and then give your body what it needs, the more like body trust you'll get.
Yeah. I don't want people to think that I have this mastered. It's like I
No,
know the
it's not.
skills, but
Yeah,
I work on it all the
right,
time and I mess up all the time. And that's
right,
very normal and human. It's just about getting right back on the horse and trying again.
right. And then the more you do it, the more like the signals become clearer.
Yeah. I really see that. The more I worked on something, it clicks in and I can catch myself quicker.
Right.
Yeah.
Um, okay, great. So this was awesome. Could you just tell the listeners where they can find you?
So, well, I guess my number also.
Sure.
um, so I have My number is 516-986-8202. I also have a profile on Psychology Today. My office is in the 5 towns in Cedarhurst. And yeah, thank
And
you
you're
so much for
taking,
listening.
new clients?
Right now, not. I'm full right now, but things change. Someone can, finish up and graduate their therapy. So it's worth a shot to ask. Otherwise, I would refer to another therapist that I trust.
Okay, great. Okay, thank you so much for joining us.
Okay, thank you so much.
Sure. Have a great day.
You too.
Bye.
Bye.